get to what I need to get to. Jesus. Alright, on Facebook. I don't want to do that yet. Oh God, what is going on here? Thank you, Jesus. So it's not singing, it's not even counting down. It's just like a Jesus. Oh, there it is. It's not like counting down.
Greetings. Welcome to Caregiver Chronicles. Friday Night Live, Ask Dr. Yvette Anything. Let me just tell you a little bit about Caregiver Chronicles. Caregiver Chronicles is a 16-module online course for caregivers. I want to just tell you also that the course consists of 16 classes, and the courses cover all areas of caregiving, all the way from the onset of your loved one's illness, all the way until they transition or they recover from their illness. So our topic for tonight, Friday Night Live, is an open forum where we're going to be discussing navigating the medical professionals. Now, we have our guest tonight, and Dr. Jessica Peterson is with us this evening. She's a doctor of audiology, and that is for the hearing impaired. Is that correct, Dr. Peterson?
Yes, that's correct.
Okay.
I do ears and hearing loss.
Okay, thank you so much for joining us tonight. And then we also have Sister Cassandra Morris on the line with us tonight. And if there's anyone who needs who needs sign language or needs someone to sign for them, she is available to do that as well. So I want to thank you both for joining me tonight. First and foremost, I just want to say that the reason for this platform is to discuss all areas of caregiving, and that it is so important that when you do have a need for a caregiver, that you are able to navigate and deal with the medical professionals. And as a medical professional, Dr. Peterson, your patients come to you and they want to have a trust that you're going to do what needs to be done. And so that's really important. You want to know how to navigate them. You want to know how to talk with them. You want to know how to ask them for, even a second opinion if it's necessary. So this is really a critical piece of caregiving. And so that's why we're having this open discussion tonight about caregiving as far as the medical professionals is concerned. So first off, I wanted to just talk a little bit about trusting the medical professionals. Dr. Peterson, I know that you have patients that you see on a frequent basis, I gather, and how important is it to you that they have a trust for you? Because if they have a trust for you, then they will kind of follow your direction as a doctor and then, follow through with it as well. So can you just touch a little bit on that, if you will?
I think that with any patient-doctor relationship, the trust is that underlying piece that has to come first. I really see my patients as part of their healthcare team. So it is not me making the decision for you. It is me talking about my knowledge, my expertise, where I come from, and presenting options that we can navigate together and pick the best option for you, especially with hearing loss, because hearing loss really varies depending on your lifestyle and depending on what you need. And so working through those challenges together to give you the best quality of life, that's the most important thing, and that can never happen without trust.
Right. And then I want to also introduce Sister Morris, because she has 2 sons. Is that correct, Sister Morris? That are
Yes.
hearing impaired. You want to just touch a little bit on that? I know that you have dealt with the audiology and that kind of thing. She has some twins, a set of twins.
Well,
That are hearing impaired.
Is everybody on the line that is deaf and hard of hearing and that needs sign language?
Not as of yet, but if you want to sign, you can go ahead and do it, because there may be some who listen in afterwards, because I did invite some groups for hearing impaired to come. So
My sign the best. I'm just going to help however I can. My youngest two sons are deaf and hard of hearing. They're twins, and they're good and grown now. They're 40 years old. But my experience with audiology was basically in schools when they were young, growing up. And most public schools provide that kind of service. But it's been a long time since they've used them in the schools. And my experience is that the parents need to be, and I guess in the case of caregivers, that you would need to be up on what services are available.
Oh,
You know, what services are available, what that person can receive based on their insurance or their medical need, and go from there. The audiologist pretty much is the one, I think, and correct me if I'm wrong, Dr. Peterson, the one that tests them to see exactly what the flow, what the level of hearing loss is, and they use that to determine what kind of services they're going to need going forth. So I would just say be up on what services are available for your particular relative, whether it's or person that you're taking care of, first of all, before you can kind of determine what you need to do next.
okay.
Yeah, I think you bring up a good point. There can be a lot of variety in care, I think, these days. I'm actually a public school audiologist. That's what I do full time.
Yeah, okay.
And then I have my online business that I've just started. And it's really a passion project more than a business, because right now it makes no money. So I don't think I can really call it that.
Here too.
Right. But I think that passion project was born out of exactly what you've identified, Cassandra. I think that it's really difficult in all of healthcare, to be honest, to find really quality information and to be able to understand your options and go into an appointment with a healthcare provider, really understanding what you need to know ahead of time to be a good advocate for yourselves. And I think some audiologists and some hearing instrument specialists are really good at like walking you through those options and presenting all the options, while others, they might have that short time and they're going to tell you one thing and you might go to the next one and you'll get something else. And
Right.
so that's completely my online course, is teaching caregivers and families of more that geriatric care, how to navigate this hearing healthcare, because I do think it's confusing, and I think there's a lot of information out there that is false or misleading, and I want people to be able to go into an appointment having that foundation of knowledge so that they can be a good advocate for themselves. Like you said, and audiology has changed a lot in the last 30 years. So we went from a master's degree to a doctorate. We're doing a lot more. I worked clinically for 5 years, fitting hearing aids, cochlear implants from birth all the way to my oldest patient was 108. And then I moved to the school system. So I've kind of seen both of those worlds and how we really, in the adult world, we kind of we do a test and we say, here, go, here, use these hearing aids. And there's not any of that advocacy training. There's not any of those resources and knowledge. And so I'm trying to fill that gap with that educational piece with these online courses of how do you navigate your own hearing health well, and how do you know that you're getting quality care? Because you're right, it can really vary, and it isn't the same with everywhere you go.
Right, because each clinician, each doctor, or each healthcare professional is going to come with their own experience about who they dealt with, how their educational background, as well as just a overall knowledge of the profession. And that makes it that much more difficult for a family member because, of course, the patients, we don't know, they don't know. And so they come to you looking for guidance and direction. And so it's critical that they have a trust for you, that they know that you're going to give them everything that they need in relation to their audiology, deficit, if you will. And so that's really important. I want to ask also, how do you deal with patients who, like, say, for instance, me, if I lost my hearing right now, how would I be able to navigate? What would I do if I lost my hearing right this minute? Would I need to go and get some hearing aids, or hearing aids are not always appropriate for the hearing impaired because some of them may never be able to hear. Correct me if I'm wrong, Dr. Peterson, you are the expert on this. but I'm just trying to understand if a person is elderly or they get to their seasoned years, if you will, and they lose their hearing. Have you had patients like that, and how does that work for them?
Yeah, so that's a great question. Honestly, 1 in 3 over the age of 65 have a hearing loss. So, and I think it's 3 out of 4 after 80. So
Okay.
if you've reached 80 years old, you more than likely have a hearing loss of some sort. Dealing with hearing loss is typically, hearing loss does occur gradually in most cases. There are some rare cases where a sudden hearing loss occurs. If it's that sudden hearing loss, you do want to seek medical care immediately because there is some treatments that they can sometimes do to bring that hearing back. But it's time sensitive, like within a week or 2 weeks, you need to be seen by an ear, nose, and throat doctor. After that, the treatment will not work. So that's kind of the hearing emergency side. The more typical is this gradual onset of hearing loss where hearing declines over time. Some of the common symptoms of this are you might feel like people mumble, you might feel like you just can't understand background noise, you have to ask what a lot, you are asking for all that repetition all the time. And that's a good spot. Even before that, I would say if you're 50, 60 years old, you should go to an audiologist and you should get a baseline hearing test. Even if your hearing is normal, they at least have a baseline then and you have a copy of that, or if it ever changes to go back and compare. Once that hearing loss starts to occur, when I fit patients, there's kind of a critical period where you're watching it and it kind of hits this more impactful hearing loss in the speech spectrum. Like, it's hard to go into that without graphs of all of this to show you where, but that's when I would say, okay, you know, this is really impacting your ability to understand. We probably need to do hearing aids at this point. Before that, between normal and my cutoff, if the patient is struggling in background noise, struggling to communicate, struggling to understand, if you have a hearing loss, I do think it's worthwhile to at least do a trial and see if hearing aids help, see how much benefit you get from them. But again, that gray area, relying on that patient feedback for benefit versus cost and seeing, you know, how much is this impacting your life? Because my goal is always that quality of life.
Right, right. Okay. So I guess if somebody, you know, loses their hearing at a later stage in life, then they would maybe want to just meet with you and talk about what their options would be. And then you would share that information with them, and then they would determine what steps they would want to take. And have you encountered patients who have lost their hearing that usually have a caregiver or have someone who is, you know, kind of navigating things for them because of that deficit? How about with the caregiver? How does that work with you?
Yeah, so I think one of the most challenging pieces can be when you are a caregiver, because you're typically the patient, you need that caregiver support because a lot of times there's memory issues, there's executive functioning issues. And so learning to use those hearing aids, learning to wear them every day, it just adds an extra layer to that like problem. And so if we go ahead and have that caregiver who's consistently in their life trained on those hearing aids and making a plan together to go ahead and get that hearing aid use to full time, it often can go better. One of the problems I've encountered is most people don't have one caregiver. They have multiple caregivers.
Yeah.
And so maybe, you know, maybe their daughter lives with them, but then during the day they go to a day program because that daughter has to work. And at the day, the daughter came to the appointments, but the day program didn't. And that older adult spends, you know, 5, 6, 8 hours with a different caregiver. And so I think it's making sure that multiple caregivers are trained well on how to deal with these devices, how to take care of them. What do you do if the person pulls it off their ear? Where do you put it so it doesn't get lost? How to change a battery, how to do some basic troubleshooting if it's not working properly.
Right, right. So I know too that I've heard patients, and I've had patients before as well, and they'll tell me, oh, I don't wear my hearing aids because they're, you know, they're not, I guess they don't adjust to the sound. Like, say for instance, if there's a noise and there's other noise in the vicinity, like background noise, that it all comes in together at, you know, at once, and they don't like it. So I've heard people say, I don't wear those hearing aids anymore because they're just, you know, I can't, you know, they're too loud and all kind of things. So have you had that experience as well, Dr. Peterson?
So I think that one of the things that can become a challenge is hearing aid technology. There is a wide array. I actually just wrote a blog post for like online geriatric magazine Rubber Care on this very topic, because there's these devices that aren't very adjustable that are a lot cheaper, and then true hearing aids that are adjusted to hearing loss. True hearing aids that are fit to your hearing test, basically to your hearing loss prescription, often do have background noise reducers, things like that.
They do.
At
Okay.
this point, the problem is so back to that, how hearing loss occurs. It's gradual. We lose the sensitivity over time. It gets less and less. Well, it's so gradual, your brain kind of forgets what full-on sound is. It's kind of like in the morning, if you wake up or you're just starting to wake up and your partner goes and flips the light on in your eyes, they almost can't handle all that light.
Right.
Hearing aids are the same thing, but they take even longer to adjust to. Research shows 6 to 9 months. Your ears got a lot of things going on as far as range of frequency and loudness levels that can occur. And so true adjustment to hearing aids would be full-time use for 6 to 9 months.
Oh.
Most people don't notice them as much if you wear them for about 6 weeks full-time, but that's still quite a challenge to keep them on your head full-time for 6 weeks. And so working with your audiologist or whoever has fit your hearing aids to maybe reduce that sound level and then slowly bring it up can really help in that adjustment period, because it can be really, really difficult to adjust to hearing aids if they're just not comfortable.
Oh, okay. Okay, that's good. I didn't know they had an adjustment where they could, kind of filter out the background noise. That's good to know. But that must be something more current as far as, current type of technology, if you will. Is that something?
I would say if you've gotten hearing aids in the last 5 to 10 years, it has some form of that technology. So the last decade, it just depends. It gets better and better. They're like tiny computers now. They do way more than you think they would. They're so smart that if you have 2 on and there's background noise over here, this one picks up the speech, it mutes this one, and it sends it over. So, I mean, they really are smart devices. They're not like they used to be, the big beige bananas that just pick up everything. A lot of times I've had people complain about the noise.
Right.
And what they're wearing is they went to like a pharmacy and they grabbed something off the shelf that looks like a hearing aid. And what those are called PSAPs, personal sound amplification products.
Okay.
Those are designed for people like maybe you're a hunter and you have normal hearing, but you want to hear in the forest a little bit more. They look like hearing aids. I think they're designed to trick people, to be honest, but their labeling says they're for normal hearing only. But I have patients all the time who are in that geriatric range where they go and they're trying to find some help. They buy this device, throw it on their ear, and it's like an amplifier. It just turns everything up. It's not adjusted to your hearing loss. It really is turning everything up in the environment.
All right, good. I just want to say, those who are listening in, if you have any questions or comments, please type them in the chat box, or if you are on Facebook and you have some comments, please respond. We do have someone on that can sign if you are hearing impaired. Cassandra, if you would let them know that if they are hearing impaired, that you would sign for them if they need for you to do so. We have someone on the line with us, Candace Conrad. Ms. Conrad, if you are wanting to type in the chat, if you're not able to join us on video and you need some signing, we have someone to do that as well here for us. Okay. So, okay, Ms. Peterson, thank you so much, Dr. Peterson. This is good information. So now, a question for you is, when you have someone that's hearing impaired and they come to you and they really don't have no direction, they don't know what to do, do you advise them to just kind of continue with their life? Because a lot of times when people lose their hearing, their whole world changes. Everything changes for them. They just have to, kind of re-educate themselves on living with this impairment. So what would you suggest that they do? I know that for the blind, they have, the Blind Foundation, the Foundation for the Blind and that type of thing. How would they go about getting services and support and resources and groups and things like that they can attend? Are you familiar with that, or could you talk a little bit about that if you have any knowledge about that? I'm sure you do.
So I think hearing is one of those things that it's tricky, because vision has been kind of on that forefront of everybody's brain. We all know we get our vision checked once a year. We do these steps to take care of it. And hearing loss is kind of that forgotten like sense where we kind of ignore it and we don't make sure those things are happening. So I wouldn't say there's actually there's HLAA, so Hearing Loss Association of America, and they do have different chapters where you can go ahead and connect with people who have hearing loss, and in different HLAA. Yeah, Hearing Loss Association of America.
Okay.
So they do go ahead and provide some of those groups, and they have different chapters throughout the U.S. However, I do feel like those aren't as common for people to go to. Most people, when they come to me and are looking for help, they are typically, most people who gain hearing loss in older age, they aren't sign language, they're verbal language. And so what they want is they want to continue to connect with people like they always have. And so that's always that goal. I do help people who are deaf too, and I sign as well.
You sign?
I do.
Okay.
Yeah. And so I think if you're in that deaf cultural world, your goals are very different because you do have that visual language, and that is that different culture and that different language that you can go ahead and support yourself with.
Mm-hmm.
People who are geriatric, they're not looking to learn a new language. They're not looking to join this different culture. They're looking to continue with their family and friends that they have. And
Right.
so often support is making sure they can do that. One thing I think we have to combat is when you start to get hearing loss, a lot of studies are seeing this not quite causality, but this relationship between dementia and isolation and hearing loss. And hearing loss, as soon as you start to gain it as an older adult, you are much more likely to isolate yourself. You're also more likely to have memory issues with that isolation. And so they don't necessarily cause each other, but there's definitely a relationship between those three things. And if we can catch that hearing loss early and combat it and keep you from going into that isolation mode by continuing to live your life, I think we can really support you much better long-term for even your brain health. And that's really the goal.
Wow. So you said that hearing loss can lead to memory loss?
Yeah, here I can pull up really quick. Let me look at, I just pulled some stats on this actually, because there's a new article.
Uh-huh.
Um,
Cassandra, did you know that?
No, because that hadn't been necessarily my experience, so I hadn't put the two together. My question is, for most caregivers, you're talking about people taking care of elderly people, older people, as they get sick and they can't do for themselves, more so than younger people. And so my question is, what would be the caretaker's role in referring an audiologist to the patient? I mean, theoretically, wouldn't they have to go through their doctor or make a recommendation to the patient's doctor, or mention that they notice that they think there may be some hearing loss or some kind of thing? But whoever's a caretaker, what would be their role in all of this? Because in most cases, they wouldn't deal directly with the audiologist, I don't think. So that's what I'm asking.
It actually depends on the state, and it depends on the insurance carrier.
You said the state?
Mm-hmm.
Okay.
So, and the insurance carriers as well. So some insurance carriers, like I worked for Kaiser Permanente for a long time, and to get a hearing test through Kaiser, it was a self-referral process. Any patient who thought they had hearing loss could self-refer and come see me. There was no need to go see a primary care physician first, anything like that. Other insurances do have that primary care piece where you would go to your primary caregiver first. You would tell them, I think I have hearing loss, and then you would see an audiologist. It just kind of depends.
Yeah. Okay.
So this study, though, that on dementia and hearing loss, it was by Johns Hopkins, by Dr. Frank Lin. He's an MD and PhD. They found that mild hearing impairment were 5 times more likely to develop dementia. Twice as likely. A moderate hearing loss tripled your loss of developing dementia, and a severe hearing loss, you were 5 times more likely to develop dementia if the hearing loss was untreated. So that's astounding to me. That
What I'm just thinking now, so because of the hearing loss and the hearing loss creates a deficit in brain activity, I'm gathering. Because when
that is the theory.
you cannot hear, you're
And the isolation.
stimulated when people are talking to you. You know what I mean? You're not getting that stimulation. So I'm not a doctor at all, but I'm just kind of, I'm like, how can that be? So,
Well, and I do want to say the caveat is this is for older adults who have verbal language. So if you're sign language and you're a deaf adult, this is not going to happen to you because your language is different. You have a visual language.
right.
Now, if you have been hearing your whole life and now all of a sudden you have that hearing loss, that's where the problem happens. We're taking away, you're right, that brain activity is the theory. You're used to verbal language, you're no longer getting it.
The stimulation is not
needed.
okay. So that kind of makes sense, but you never would think that hearing loss would lead to some dementia, and then maximum hearing loss would lead to some Alzheimer's. So that's really something. Are there other medical ramifications of hearing loss that you are aware of, Dr. Peterson? Any other areas that would, the hearing loss would have a profound effect on with regard to our health?
One other area that they're really looking at, so there are several chronic health conditions that are more likely to have hearing loss along with them, specifically diabetes and also any cardiac issues are more likely to have hearing loss. One study that I've looked at, and I think there's still research ongoing with this, but they looked at monitoring early hearing health in regards to also following some heart health things. So like if you had some hearing loss, monitoring your heart health a little bit more as well to see if things were developing, and looking at hearing loss if it was an early predictor of other things occurring later with heart health. So there are definitely correlations. Your ears, just like every other part of your body, everything is related. And so if we see changes in one part, those ears are really sensitive to those chemical changes, and we need to check them as well.
Okay, that's interesting, very interesting. And then you said about isolation. So a lot of times when people are having a hearing deficit, they kind of go into an isolation because they're not able to hear, and so they don't, respond, I guess, as they normally would, and then they kind of go into a kind of like, isolation mode. Is that correct to say, or safe to say, Dr. Peterson?
Yeah, so I think of it like if you were earplugs to a restaurant, or one earplug to a restaurant.
Okay.
And you tried to have a conversation, you could probably carry that conversation, but it would be a lot more work. It would cause a lot more fatigue, auditory fatigue. You'd be tired afterwards. Hearing loss does create this extra workload in our brain to constantly process the sound, and then that does in turn cause this extra fatigue when it's this untreated hearing loss. And so then what we end up doing is we're so tired, we're like, I used to want to go out, but it's just so much fatigue, I don't want to. And we start to avoid those situations that are difficult and more work for us. And then what happens is typically if we're not doing the things we love, we start to gain, it can't even fall into that depression stage that isolation can lead to. And so it's a bad circle to get into, and it can be really hard to break out of it without the right help.
All right, that's interesting. So what would you suggest to someone who is experiencing some deficit? They're starting to slip into a depressive state because they can't hear. They've already been diagnosed, and they just don't know what to do. They may not have the financial means to have the support that they need with regard to a caregiver and that type of thing. I mean, I don't know what I would suggest to someone like that. What would you say to them, Dr. Peterson? What would you?
I do think I think there are resources a lot of times. They just might be harder to find. I wish that Medicare, I'm a huge advocate for Medicare covering medical devices like hearing aids. Right now they're classified under the FDA as elective, and it's unfortunate because it really does give the cost to caregivers, families, and people who have a hearing loss rather than it being covered well. I think it's something that we need. It's something that there's a lot of research that shows that we need these devices. But there are foundations out there that give grants. If someone is working, there are government agencies that can help provide funding specifically Each state has the Division of Vocational Rehabilitation. And if you're working and you need a hearing device, they will absolutely help support that in most cases and pay for it on a sliding scale need base. There's a Starkey Here Now program where there are some audiologists who work in tandem with Starkey, the hearing aid company, providing discounted hearing devices for people in need, again, sliding scale. So there are some options out there. There are foundations. Most of them are local. So I would look at those local foundations.
So I'm just trying to understand, and I don't know if you're aware, because if a person is Medicare and Medi-Cal, they're Medi-Medi, which means they're covered across the board with regard to their insurance needs. Would their hearing aids be covered under that type of, no?
Typically, no. It depends. It absolutely depends on your individual policy. I did have some patients who had elected like our insurer coverage under their two sponsored coverages, and they did have a benefit, but it was definitely rare and it was per person. So I would encourage you to find an audiologist and talk to them about options. Look at your insurance first and express your need for that financial help to really make sure that you can find that right piece to help you.
And they're pretty expensive, right? Like maybe $2,000 to $5,000. Is that safe to say?
Mm-hmm.
Yeah.
I would say an average pair of good hearing aids is about $4,000.
You had to pay for some of those, Cassandra?
Oh yeah, you have to pay, and that's the biggest problem because most insurances don't cover everything, and so people are going to elect not to use the service even if they're aware of the service. But I know with my father, I don't remember an audiologist, but I remember, I guess his doctor, an appointment, a referral was made some kind of way for him to go for hearing aids, which he actually never went to go get, but he did have a pair. I don't know how and when, but he never wore them, that kind of thing. Yeah. So even with the ones I'm aware of that he could go to get, we never got around to that appointment. They were going to be expensive, and he had Kaiser. So my experience has been that and I was curious about the answer with Medi-Cal, they may cover something, but I don't recall. It seems like it's going to be some cost factors between getting the exam, the audiology exam, and then or even having a referral, and then getting tested, getting fitted.
Wow.
And then getting the hearing aids, because getting fitted, that's one thing, depending on the kind of hearing aids you have to have. You have to have a mold or something. That's one thing. So it can be pricey,
wow.
And more than what somebody wants to pay, especially with half of it is the buy-in that I need this and I'm going to use it.
Right.
That's half of it right there. You say a cost, then they're not going to jump on it. Now, if it's somebody that already had hearing, and like some older people, as was discussed earlier, and then they're sort of losing it, it's a little different, and you see more people gravitating to getting some kind of aid, and the smaller ones that kind of fit in your ear.
Right.
And if you can afford it, then that's better, and usually that might be one ear and not two, it just varies. But the average person has to be is not quick drawing them not quick to get hearing aids.
Right.
They try just make do.
Most people wait about 7 years. They have a hearing loss for an average of 7 years before seeking help. That's the stat of it. And
it's a long time.
The unfortunate part is we're seeing brains change a year into hearing loss. And so that research that's showing this brain change is so important, because we are waiting because of the financial implications, because we're not sure if we're going to see benefit. We're waiting to seek help, but the function that we're losing, we can't get back. And I think that's the hard part about waiting.
Right. Yeah, I was just thinking, I was like, okay, so I guess the insurance companies don't feel like it's an essential piece of life, if you will, for a person.
I believe it's because of how it's labeled under the FDA.
Okay, and how is it?
I think I believe it's labeled as a elective medical device, and because it's an elective medical device,
Because it's not a life sustaining, if you will, piece of equipment. So if it was something, it was related to you're needing to have it to live, in other words, if you don't have it, like dialysis, for instance, if you don't have, your blood filtered 3 times a week, 9 times out of 10, your blood's going to poison. You're going to pass. You know what I mean? So that's why I guess the insurance companies do not,
But they're going to look at it in terms of money. And, if most people don't have to have it, then they're not going to see it as being essential to them. That's elective, and if they can't benefit by it until everybody needs it, or most people need it, they're not going to include it. And then, of course, nobody's lobbying for it,
Right, right. That's something. That's really something. Oh, wow. So it can, so I'm backtracking now. And then those of you who are listening in, if you have some questions or comments, please type them in the comment section or the chat, and we will definitely respond to you. I myself will respond to you, as well as Dr. Peterson. I'll make sure she gets that information to respond as well. And then Dr. Peterson, before we close, I want you to talk about your project, okay?
Yeah.
We'll do that as well. But I'm just thinking about, so hearing loss can lead to memory loss. It can lead to isolation. It can lead to depression. It can lead to diabetes. I mean, well, the diabetes can
that relationship is there. Yeah.
There's a relationship between diabetes and hearing loss, and then cardiac issues and hearing loss as well. I had no clue about that. And so that's really something to understand. I'm just thinking.
I would add to that in there somewhere nutrition deficits. I mean, not like eating or take properly, or health considerations in general. They sort of let things go because they don't hear or understand the necessity. And so then that leads to maybe some of all that other stuff, or they're eating the wrong things, and maybe that's leading to diabetes and so on.
So their diet isn't,
Diet is off.
Well, that's safe to say. Would have an effect, Dr. Peterson? Is that something you would adhere to or understand?
So I think more the relationship between those three is typically, like, if you're not caring for yourself, that diet exercise piece,
Right.
that may lead to like type 2 diabetes, and you do have a higher risk for hearing loss because of the vascular changes and the blood flow changes when you do have that type 2 diabetes. So if you are pre-diabetic or you do have diabetes, then that may lead to that hearing loss as well.
That's something. Okay, so I wanted to just have a couple of other topics here. I want to just bring them up and see if we can kind of incorporate them, and then we'll talk about your project, and then we'll be done in a little bit. Ensuring your loved one gets the maximum services that they deserve. That's a critical piece, because a lot of times, and we've kind of touched on it a little bit, when a person has a caregiver, the caregiver may not understand the ramifications of having a medical professional, or incorporating the medical professional into the plan of care for their loved one. And so I just want to mention that. Dr. Peterson, any thoughts about that you could share with us, how important that is? And I know you're not a medical doctor, you're a doctor of hearing. You still are a healthcare professional, you know what I mean? And so I just wanted to touch on that a little bit.
I think and within my field, one of the things that I notice is that if you're not involving an audiologist and you are a caregiver, often you're a caregiver because there's some form of cognitive or memory issue that's going ahead and happening. And a hearing loss can actually amplify and act like a cognitive or memory issue. So you may have this cognitive or memory issue, but then you may also have a hearing loss. And you may be thinking that the hearing loss is actually a worse memory issue than it is, because they're not able to communicate because they can't hear. So I think you have to, even if you don't think that person has a hearing loss, if you're a caregiver, making sure they are hearing well and able to communicate is going to make caregiving a lot easier. and make sure that we're not missing any issues that are maybe exasperating other things. And so I think that piece is really important to include.
Right, right. Okay, okay.
You know, I would add too that caregivers probably, I mean, we hear more about caregiving now than we ever have, you know, in the past, and that caregivers attention be given for caregivers to feel more empowered or understand the need to address things that they notice, you know, like adding hearing loss to the list as opposed to just the physical needs, you know, like giving them a bath, you know, or taking them their medicine, giving them their medicine and that kind of thing, that kind of limited caregivers in those areas, but to make them feel like, you know, if you notice, you know, some form of hearing loss, so you notice not eating a full meal or whatever the case may be, you know,
Right.
to that they, them being in that position allows them to recognize changes
Mhm.
in the person that they are providing services for and to make recommendations, you know, accordingly.
Right, right, right.
Don't feel like that's their job, you know.
Yeah,
They
yeah.
don't do that.
If you are a caregiver, you recognize that your client or your loved one or whomever you're caring for is having some hearing deficits, you want to get them to the doctor, because if you're starting to repeat things to them, they may be forgetting or they may not be hearing. So it's got to be one of the two.
Mhm.
So you want to rule out, if you will, what it really is. If it's the hearing deficit, then you'll be able to rule that out when you go see the audiologist like Dr. Peterson. But if it's a memory, a cognitive issue where they're having some memory issues and they're responding to you, not appropriately, if you will, then you would want to take them to their primary physician or to a geriatric doctor as well, to make sure that they can do an assessment. They'll do an MMSE, a mini mental status exam. They will do various testing to determine the cognitive, ability of your loved one. So I just wanted to bring that up because the two, they might have a hearing loss deficit or they could have a memory issue. One of the two areas. So you can always have that tested to make sure, and then rule out and then determine how you can best help your loved one. So I just wanted to bring that up. Let's see. So there's some other areas here I have. Knowing what services are needed for your loved ones, the same concept basically. Knowing what their needs are by going to the doctors, making sure you know what those diagnoses are, if you will. And then that way you can, as a caregiver, provide them with the needs that, meet the needs that they have. So any comments on that, Dr. Peterson, you want to chime in on that?
Yeah, I think you're spot on. I think it's, both of you just focusing on what that person needs and really noticing like what you might be struggling with. If they're asking you to repeat a lot, something like that, it may be a hearing loss. It also may be a memory issue. And I think it is important to build a team that, again, back to that first question, building that team that you trust. The caregiver is a part of that team. The patient that you're caring for is a part of that team. Your doctor is a part of that team. Any other family members that they interact with on a daily basis, it's a team, and everybody needs to be able to have this good communication to figure out problems and to make sure that everybody's getting that best quality of life that they can. We work really hard our whole lives. We don't want to get older and just have it be a struggle to enjoy the family and the friends that we have around us. Our time is our greatest commodity, and if we don't value that and we don't use that to the best extent we can, we're really, it's sad and we're falling short. So building that team, I think, is so important.
Right. And another area too I want to just mention is getting a second opinion. You go to a doctor and they tell you, what's going on with your loved one, and you believe them, that's fine, and you trust them, that's fine. But you want to get a second opinion so that way you'll know, if two doctors tell me the same thing, then I kind of have a reassurance that this is likely the case. And it may or may not be, but you can ask for a third or fourth opinion. I know I had one of my friends who is a nurse, and she said when her dad was ill, she had 3 or 4 opinions because she wanted to be sure. And so it's okay to ask for another opinion. It doesn't mean that, you know, if you go to see Dr. Peterson, for example, doesn't mean that she's not qualified to do her job. It means that you want to have the comfort level to know that what she has told you is correct, is complete. Because sometimes, and no reflection on you, Dr. Peterson, sometimes when you see a medical professional, they give you a piece of it, but they don't always give you all of it. And so if you're not a healthcare professional, as I am, and as Dr. Peterson is, and as Cassandra is, as far as a family member with a hearing impaired twin, you know, if you don't know, then it's best to make sure that you have the medical professionals and, you know, you get the services and the treatment that you need. So that's really critical. I just wanted to bring that up.
Is there any way, is it out there any kind of way that audiologists can come into the home and give the exam, or can it be done virtually?
Home health audiologist. That's a good one.
Well,
Start that up, Dr. Peterson. That's another area you can get going.
right. There is some telehealth research, and there are some devices where you can do some hearing screening, ship it to the house, and do a basic hearing screening. But as far as that full diagnostic exam, one of the struggles we run into is acoustics of every room are different, and so we really need that sound booth to get those true threshold, those prescriptive measurements of that hearing loss. So I think of like the room I'm in maybe has 7-foot ceilings and is 10 by 10, but the place that I ship that device to test that person's hearing, it might be hardwood floors, vaulted ceilings, a big room. The background noise is going to play a big role. And so just a little bit of background noise can throw those thresholds off, and then we just don't get a good hearing test to fit. It's one of the things that does scare me. There are devices coming out on the internet where they're testing you with your own headphones in your house. And I think those can be scary. They can be fit wrong, just because you take that risk of, if there's background noise, if there's something else going on, your prescription could be wrong that you're following.
Well, I just asked that not just because of the pandemic, but that might be a way of adding to getting more than one opinion, a second or third, 2 or 3 opinions, also, or an opinion before, or knowing what to ask your primary physician. But also, in the case of caregivers, you may be in a situation where you can't get that person out the house, or they're never going to go, or they might try this a little easier if it was,
for sure,
they had more information about it, because that it was done virtually, or certainly if it was done in their home, where they feel like they need to go and do something,
I have before, for like patients who really struggle to leave their home, things like that. It has been very close relationship, people within my own bubble, but we do have portable audiometers where I can meet them somewhere and I can test, but I already have that baseline test that was done in a sound booth to compare to, of like, this is my best test. And then if things change, I can kind of think about, okay, what's our environment? Are there ways that I can troubleshoot the background noise, or I can move them to a smaller room that maybe doesn't have as much noise? So there are ways to kind of double check and see if there are big changes, certainly in remote places. I think that initial test is important. But even if you get that test in one place and you want to talk about hearing aids with several providers, you could take that test from a provider to a different provider. And I would absolutely encourage that, because I think opinions are important, and hearing aids are not covered and they're expensive. So finding out your different options and what those different options include. Some hearing aids, like if you buy a pair, you're covered for all the adjustments, all the appointments, everything till you those hearing aids are no longer working and you choose to get new ones. Other places, you're covered for those appointments for a year. So really understanding like what appointments you get with what you're paying for is so important.
Okay. So basically you're saying that you have, in order to really test, you have to have a sound booth to do it.
For that first baseline test, yeah.
Okay. All right. So it wouldn't be a good idea to do the in-home thing. It'd be
for a hearing screening, absolutely. You could do it in home just to see, do we think we need further testing, or is hearing normal? I think that is absolutely something that we'll see in the next few years. It's unfortunate. In the beginning of September, there's the U.S. Department, there's a department in the U.S. and they started looking at it in Congress to provide hearing screenings for adults over 50 within the primary care office, mandating them. And they said there's not enough evidence to have those preventative screenings happen yet, which is unfortunate because we have that for newborns, we have that for kids, and it's very likely that you have a hearing loss above age 50. You get more and more likely to have one. So it's unfortunate they said we don't have to do those screenings yet. So that's one way that I know a lot of people are lobbying for that piece and then the hearing aid piece, but it was, again, said, no, we're not going to require primary physicians to offer these screenings.
Okay, thank you. So that's really great. Dr. Peterson, I thank you for sharing this information with us. I want to have you talk about your project, if you will. You have an online classes, is it, for those who have the hearing impaired? You want to tell us about that?
Yeah, so I think this goes along with everything we've been talking about tonight. I think there's a lack of accessible education about hearing loss, hearing aids, communication strategy, how to go through that hearing aid process. I have a small piece on cochlear implants, so I've developed this course to walk people and caregivers through hearing loss. From the testing, I go through what is a typical diagnostic hearing test, what is each part, and how do I use each part as a provider, what does each part mean to me, how to read that hearing test. It's a graph called an audiogram, and there's some speech testing, so I go through what do those results mean, how to understand them. I talk about current hearing aid technology, the basics of it, what you should look for, how do they manage background noise, how do they manage that squealing sound feedback,
Right.
what are different styles, and then I have a section on walking through the hearing aid process. So you start where, and then how do you go through that whole process? When are you fit? What are the typical follow-up appointments? What are the routine maintenance for hearing aids and for hearing health? And it really is to kind of provide this map of care for anyone who's experiencing hearing loss or the people that are caretaking for them, because I think it is hard. My personal experience is, I was diagnosed as type 1 diabetic when I was 22. And so a little bit late in life for type 1. And I got thrown into this world of all this new healthcare stuff as I was learning how to care for patients with hearing loss. I was in grad school at the time. So I kind of had this unique patient experience with something I didn't know.
Okay.
While I was also learning to care for other people and teach them about what I knew.
Right.
And what I realized is it's really hard as a patient to go into a doctor's office and not to be intimidated and to really understand all that information at one time.
Right.
And so my personal experience is I could retain probably 20% of what they told me at every appointment. And if they would have given me something to watch and a dense thing to read, I could have gotten it a little quicker. So I wanted to create something that made it easier for patients and for caregivers. And I think that one thing you encounter in the healthcare world right now is everybody talks about time management and cost. Everybody is worried about keeping those patient appointment times as minimal as possible because time is their revenue and they have to turn those rooms over. And so, it's the same thing with audiology in all of those worlds. And so that education piece, you do as much as you can in the time you have, but you can't pack a 3-hour course into the 45-minute appointment that you're given.
Right.
And so that is kind of my passion project and where it came from. It is on my website. It's www.audiologyconsults.com. I'd love to see anyone who's listening, if you want to enroll, or if you have questions, I have a contact form there too. It goes directly to that email. So I can certainly connect with you there as well.
Okay, great. So those of you who are listening in, if you are interested in Dr. Peterson's courses for hearing impaired and walking a caregiver through that and the patient as well, I gather, you can always email me, or you can email her. You can contact me at Caregiver Chronicles 24/7@gmail.com, or you can go to her website, www.audiologyconsults.com. Is that correct?
That's correct, yep.
And we will respond to you, or you can also type in the comments section if you're listening on Facebook, and I'll make sure she gets the information as well. So that is great. I want to thank you, Dr. Peterson, for joining us tonight. This is great information. It's very helpful for those who are caregivers and those who need the care as well. It's important that we share information. I also want to tell you all about Caregiver Chronicles. We have the 16 modules on caregiving. So we go from the onset of your loved one's illness all the way until the end of that illness or until they recover or transition. It is a complete curriculum, as well as Dr. Peterson's complete curriculum on hearing, hearing deficits. So I think these two kind of complement each other, if you will, in my eyes. And so I think this is a great platform for us to share this information. I also have a new website that is available to you. It is www.caregiverchronicles247.com. So if you're interested, please take a look at the website, and then we can respond to you as well. I want to thank you for joining us tonight. I want to tell you all about next week. We're going to be talking about community resources. So I will be presenting myself next week. I'll share the information on community resources for the state of California and other states as well. So if you're interested, please join us next week on Friday Night Live. Ask Dr. Yvette Anything, 6:00 p.m., same time, same place, okay? God bless you. Thank you for joining me tonight. Thank you, Dr. Peterson. Thank you, Sister Morris.
Thank you.
Sign necessarily. Have a blessed evening. Take care.
Okay.
Okay, bye-bye. Bye-bye.